Hello dear friends, I am Amit Belikar from Tips and Tricks by AMB. Welcomes you to my channel. Before moving further, if you still didn't subscribe to my channel, please click on subscribe button and click on bell icon to get more notifications of all my new videos. Today in this presentation we are going to discuss about next important part of pharmacodynamics, that is factors affecting drug action, part 1. After going through this video, the learner will be able to enlist factors modifying drug actions and describe various factors modifying drug actions. In one of my previous video named Pharmacodynamics Principal Drug Actions, already we had discussed that drug produces various actions in our body. The effect or action of drug can be modified, means action of drug can be increased or decreased. Many drug related or patient related factors may modify action of drugs. In this video we are going to discuss these factors affecting or modifying drug action. So which are these factors? These factors are as follows. First is body size. Second is age. Third is sex. Fourth is the genetics. Fifth is route of administration. Sixth is environmental factor. Seventh is time of administration. Eighth is psychological factor. Ninth is the pathological states. 10th is cumulation. 11 is presence of other drugs, and 12 that is drug tolerance. So these are the various factors, total number of 12 factors which are affecting or modifying the drug action or action of the drug. So we are going to discuss these factors one by one. First we are going to discuss about body size. Size of body plays an important role in drug action, as dose of the drug is mostly dependent upon body size. Body size influences the concentration of drug attained at the site of action, or concentration of drug that reaches at the site of action. It is influenced by body size. The average adult dose refers to the individuals of medium build of about 70 kg body weight, but for exceptionally obese person or exceptionally lean person and for children, average adult dose cannot be accepted. If we give this average adult dose in an obese person, we will not get desired amplitude of action in that obese person. And if same dose, if it is given to lean individual or children, it may prove toxic or fatal in them, in lean individual or children's. Hence, in such individuals, the dose of drug should be calculated from average adult dose. We are not giving same dose to excessively obese or excessively lean person or in children. We have to calculate it from the average adult dose. So how it is calculated? It is calculated by using two ways. First, on body weight basis we can calculate the dose, and second we can calculate the dose on body surface area basis. So first we will discuss how individual dose is calculated on basis of body weight. So individual dose can be calculated on the basis of body weight by using following formula. So formula is individual dose is equal to body weight in kilogram divided by 70, that is the weight of average individual, into average adult dose. So by keeping or putting the value of that body weight in this formula and average adult dose of that particular drug in this formula, we can calculate the individual dose. Now we will discuss how individual dose is calculated on the basis of body surface area. On the basis of body surface area, individual dose is calculated by another formula, and the formula is individual dose is equal to body surface area in meter squares divided by 1.7, that is the factor, into average adult dose. So if you know body surface area and average adult dose of a particular drug, we can calculate individual dose for that person. So what is body surface area? How it is calculated? Body surface area can be calculated by using a formula, and formula is body surface area in meter squares is equal to body weight in kilogram into height in centimeters into a factor, that is 0.007184. So that is the factor. By using this formula, we can calculate body surface area. So if you know the body weight of the person, if you know height of that person, we can put these values in this formula, we can get body surface area, and whatever body surface area we get, we can put this value in the above formula to calculate individual dose for the person. So it has been found that body surface area basis calculation provides a more accurate basis for dose calculation than body weight basis. So body surface area basis calculation is very important. So that is about the body size. Now next we are discussing another factor, that is age. It is an important factor as various systems of a body develops or matures at different ages. So all the systems or all the organs of our body, these are not fully developed or fully matured at our birth. It takes some time to develop some systems in our body. So in newborn infants, glomerular filtration rate and tubular transport mechanism present in the kidney is immature. It is not matured yet. So it takes about 7 months to mature. So till then, if drug it is given, it may produce some consequences. So what are the consequences? Thus, plasma TF of drugs excreted by glomerular filtration and tubular secretion is prolonged. For example, streptomycin. So it is eliminated by glomerular filtration mechanism, tubular secretion mechanism. So if these systems are not yet developed in the infant, and if you are giving that drug, that is streptomycin, to that infant, there are chances of toxicity production of streptomycin in the infant, because processes which are responsible for the elimination, these are not developed and drug it accumulates in the body. Similarly, hepatic drug metabolizing system is inadequate or not well developed in newborn babies. Duration of action of drugs which are majoritarily eliminated or majoritarily metabolized by liver may be increases in the infants. So drugs are not metabolized because whatever the enzymes responsible for metabolism, these are not yet developed in the liver, and such drugs may get accumulated in the body, and there are chances of production of toxicity of that drug in the infant. For example, chloramphenicol. So if chloramphenicol is given to the infant, there are chances of accumulation of chloramphenicol in infant body, and there are chances of production of toxicity which is called as gray baby syndrome in newborn babies as toxic effect of chloramphenicol. So why it is produced? Because it is not metabolized easily and it accumulates in the body and produces this gray baby syndrome. In new infants, blood-brain barrier is also not matured. So it is more permeable than the adult blood-brain barrier. So drugs attain high concentration in the CNS. As blood-brain barrier is permeable, it is allowing drug to enter into the brain, and because of that, high concentrations of the drug can be achieved in the CNS, which are not mostly achieved in the adults. So drugs are given very cautiously in the children, because majority of the drugs can entering the CNS in the children, which are not entering in the CNS of adult person. So we have to give drugs very cautiously if we are giving drug to the children. Thus these factors should be considered while prescribing the drug to the infants or children. Then how much drug is to be given to the children? How the dose is calculated for child or children? In case of children, dose is calculated by two formulae, which Young's formula and Dilling's formula. So what are these formulas? First formula we are discussing, that is Young's formula. Young's formula is child dose is equal to age divided by age plus 12 into average adult dose. And another formula is Dilling formula. So what is Dilling formula? Child dose is equal to age divided by 20 into average adult dose. So that is Dilling's formula. Okay. So if you know the age of the children and if you know average adult dose of the drug, you can calculate the dose required for child by using any of these formula, that is Young's formula or Dilling's formula. So as we are giving emphasis to dose of drug in case of children, we have to give emphasis on the dose of drug for elder persons too. Why this emphasis is required? As age grows, there are some physiological changes can take place in human beings, which may leads to or these may affect the action of drug. And because of these effects, we have to give emphasis on the dose of drug in elderly patients. So what changes are produced in elder patients? We will discuss. In some elder persons, either renal functions progressively diminish or hepatic microsomal enzyme concentration get reduced and hepatic blood flow may also reduces. So due to diminished renal function, drug elimination is reduced. So renal function if it is diminished, elimination of drug is also reduced. Drug gets accumulated in the body of such person, which may be toxic in that person. So in such person, drug doses should have to be reduced. Also, due to less number of hepatic microsomal enzymes, capacity of body or liver to metabolize various drugs is reduced. So again, metabolism is reduced, so its elimination is also reduced. And if metabolism and elimination is reduced, drug may get accumulated in our body or drug may remain in our body for long duration, and there are chances of toxicity of that particular drug in that person. So here also we have to reduce the dose. So hence in geriatrics, that is elderly patients, dose of drugs should be reduced and can be calculated on body weight basis or body surface area basis, as we had discussed in some previous slides. So that is about the age. Next factor we have to discuss is sex. Male and female have some physical and mental differences which may affect the action of drug. Females have smaller body size and require low doses as compared with the male. So that is well known, that is females are having smaller body size as compared with the males majoritarily. And because of that, we know that if body size is reduced, dose can be reduced. So low doses can be used in females than the males. Androgens are unacceptable to women, as androgens are male sex hormones. So these are not accepted in the women. And estrogens are unacceptable to men. Why? Because estrogens are female sex hormones and these are not accepted in the men or males. Effect of some drugs may differ in females than males because of their mental or physical makeup. So there is difference in the mental or physical makeup of male and female, and because of that some drugs may differ in action in male and female. For example, a number of antihypertensive drugs like beta blockers interfere with sexual functions in males. That is, they reduce penile erection. But this problem is not associated with the females because females are not having penis. So there is no problem of penile erection in females. Also in women, precaution should be taken by considering menstruation, pregnancy and lactation. There are marked physiological changes can occur in women during pregnancy which can alter drug disposition or drug movement in body of that woman. So what are the changes, physiological changes which can occur in women during the pregnancy? So first difference is that gastrointestinal motility, that is peristalsis movement of GI tract, it is going to be reduced, and because of that it delays absorption of orally administered drugs. So gastric emptying is not taking place rapidly, drug is not reaching to the small intestine rapidly, and because of that absorption can be delayed of various orally administered drugs. Second difference is that plasma and extracellular fluid volume, it is going to be increased, and because of that volume of drug distribution is also increases. So we have to increase dose accordingly. Another difference is that plasma albumin and acid glycoprotein levels decreases, due to which unbound fraction of acidic drugs increases while basic drugs decreases. So in some previous video we had discussed, during the distribution we had discussed albumin and acid glycoprotein are responsible for distribution of drug, and if their level it is going to be decreased in blood, drug remains in more concentration in unbound form than the expected bound form. Okay, so unbound form, if it is going to be increased, it can reach rapidly and in more concentration into the site of action, and thus it increases toxicity of that acidic drugs. Another difference is that renal blood flow increases during the pregnancy, due to which polar drugs are eliminated rapidly. So these drugs, as these are eliminated rapidly, their duration of action it is going to be reduced. Because of all these changes during the pregnancy, and ultimately the effect of drug can be seen in mother as well as fetus. So whatever drug it is taken by mother, its effect we can see in mother as well as fetus in the womb. So effect in mother is not significant because whatever dose we are giving to mother, it is according to the body weight of that mother, but whatever dose which reaches to the fetus, it is very significant. Thus if drugs are taken by pregnant woman, it will affect or do changes in fetus which may be toxic to the fetus. This may not be toxic to the mother, but it may be toxic to the fetus. So during pregnancy it is advisable that drugs should be avoided or drugs should be taken if there is very necessary of using the drug. Then and then only drugs are given to the pregnant woman. Otherwise drugs should be avoided to the pregnant woman because it ultimately affects the fetus and it may produce toxicity in the fetus. So before moving to next factor, we will go through animation. If we get a group of people with having same disease and they are given with the same drug and same dose, then we will found that out of these group of peoples, in some people the drug is beneficial and no toxic effect is seen in that peoples. In some people the drug is found beneficial, but along with beneficial effect, toxic effects are also seen in these peoples. In some peoples the drug is not found beneficial, but it produces toxic effects, and in some peoples the drug is not found beneficial and toxic effects are also not seen in them. So if we are giving same drug in the same dose to a group of people having same disease, we can get variety of peoples, isn't it? So here we can see that the intensity of effect of a drug as well as required dose to produce same effect may vary among different individuals. Now question arises, why is this difference in the action of drug or dose of the drug? Answer of this question is nothing but our next factor, that is genetics. This difference is mainly because of genetic variation in the individuals. Rate of drug metabolism is dependent upon the drug metabolizing enzymes present in the person. The amount of drug metabolizing enzymes in an individual is dependent upon his genetic setup. There is difference in binding of drug with receptors also in different individuals. Thus, due to difference in the receptor sensitivity, drug effects may vary in the individuals. This is also because of genetic setup. The receptor sensitivity also depends upon the genetic setup. Now we will discuss some examples of genetic variation. Some persons genetically have atypical pseudocholinesterase enzyme which is less effective than normal enzyme in hydrolyzing drug succinylcholine. You can see here that typical pseudocholinesterase enzyme is easily hydrolyzes succinylcholine drug, but atypical pseudocholinesterase enzyme is unable to hydrolyze this succinylcholine drug. And if this succinylcholine drug, if it is given to such a person which is having atypical pseudocholinesterase enzyme, it leads to accumulation of drug in body or increase of concentration of drug in body of that person who is having this atypical pseudocholinesterase enzyme, and in such individual prolonged respiratory paralysis can be produced even with therapeutic dose of the drug. So the drug which is therapeutically effective in other person, it is producing respiratory paralysis in such individuals who are having a typical pseudocholinesterase enzyme. So that is the importance of genetics. Another example we are discussing, that is acetylation status. So autosomal recessive genes which are present in the body of the individual decides the rate of acetylation or metabolism of drug isoniazide. So isoniazide is metabolized by action acetylation, and the rate of acetylation of isoniazide, it is decided by autosomal recessive genes. Now depending upon status or rate of acetylation, individuals can be divided into two types: slow acetylators and fast acetylators. So what happens if isoniazide is given to slow acetylators and fast acetylators? We are discussing. If isoniazide is given in slow acetylators, as metabolism of it takes place slowly, drug gets accumulated in the body and it may leads to toxicity of isoniazide. So to avoid toxicity while giving isoniazide in slow acetylators, we have to reduce dose of isoniazide. Understood? Similarly, if isoniazide is given in fast acetylators, opposite can happen. So acetylation takes place fast, rapidly, that is metabolism takes place rapidly, and because of that drug gets rapidly inactivated and desired concentration of drug cannot be achieved in the individual at the site of action. And to get desired effect or to achieve desired concentration in fast acetylators, we have to give higher dose of isoniazide. Otherwise we are not getting action of isoniazide in fast acetylators. So in slow acetylators we have to reduce the dose of isoniazide, and in case of fast acetylators we have to increase the dose of isoniazide. So that is the variation in the genetics. Now we are going to discuss about next factor, that is route of administration. So route of administration decides the speed and intensity of drug response. Already in route of administration video, which is associated with the route of administration, we had discussed that onset of action of drug by oral route is always lesser than the sublingual or parenteral routes. In some cases, a drug may have entirely different therapeutic effect and uses through different routes. For example, we are discussing the effect of magnesium sulfate by different routes. If this magnesium sulfate is taken by oral route, it causes purgation. It is purgative in nature if it is taken orally. But when it is applied topically on inflamed areas, it decreases swelling. So it is anti-inflammatory when it is used topically. And if this magnesium sulfate is given intravenously, it produces CNS depression and hypotension. So magnesium sulfate is only one drug, but if it is given by oral route, produces purgative effect. Topically, if it is given, it acts as anti-inflammatory, and if it is given intravenously, it produces CNS depression and hypotension. So entirely different effects are going to be produced by magnesium sulfate if it is taken by different routes. So route of administration is again very important if we consider drug action. Okay, so till now we had discussed body size, age, sex, genetics and route of administration of drug. These factors, their effect on drug action. Now we are moving to next factor, that is environmental factors. So environment in which the patient is present plays a very important role in modification of drug action. So how this environmental factor affects drug action? Already in one of my previous videos of metabolism of drug, we had discussed that factors like exposure to insecticides or carcinogens, means cancer producing chemicals, or tobacco smoke induces or increases drug metabolism. So if these inducers are present in the body of person, drug metabolism rate, it is going to be increased. So metabolism, if it is going to increase, inactivation is increased, and in such case duration of action of drug can be reduced. So that should be considered while giving the dose of that particular drug. Also, altitude in which we are present plays an important role in metabolism of drug and ultimately effect of drug. So what is altitude? Altitude means where we are present from the sea level, the height at which we are living from the sea level, that is called as altitude. So why this difference is there in the rate of metabolism? So it is because of oxygen. Oxygen present in blood plays an important role in the metabolism of drugs which takes place by oxidation reaction. Okay, drugs which are metabolized by oxidation reaction, for that oxygen level in blood is very important. And this oxygen level in blood, it depends upon the oxygen level present in air which we inhale. So oxygen level in air, it depends upon the altitude. So as we move towards high altitude from sea level, oxygen percentage in air is going to be reduced. Here you can see that at sea level, if oxygen percentage in air is considered as 100, then as we move upwards towards the mountain areas, it is reducing to about 33%. So that much reduction can take place in the oxygen level in the air. So this reduction in the oxygen level in air reduces the capacity of body to oxidize or metabolize drug at high altitude. So it may produce drug toxicity. If we are living in high altitude and taking same dose which we are taking at the sea level, there are chances of reduction in the metabolism and drug accumulates in the body and it may produce toxicity. Well-known example of this environmental factor is that alcohol. Alcohol is well tolerated in winter than in summer. Now we are discussing a fact which is not related with our today's topic, but I feel that I have to discuss it with you, my dear friends. So what is this fact? In India, there are many yogis you can see. If you see such yogis, they are always found more energetic and fresh than us. They are also having a type of glow on their face. So question arises that why they are more energetic, why they are always fresh, why a glow on their face is always there. We will discuss fact which tells us why they are more energetic and fresh. Mostly these yogis are doing their sadhana or tapasya in Himalayas or on mountains, isn't it? They are mostly coming from the mountains or Himalayas, and we know that as we go to higher altitude, percentage of oxygen in air is going to be decreased. So body of yogis adjusts itself to the environment at the mountain areas. As oxygen level in air is low, there are chances that yogi's body also gets less oxygen, and because of this less oxygen supply to the tissue due to reflex action, body of yogis increases the production of RBCs. So the persons who are living at hilly or mountain areas for long duration, there are chances of increase in RBCs in their blood than the persons who are living at lower altitude. When such person or yogis come to lower altitude place or location, they are having abundance of RBCs in their blood, and in environment also there is higher percentage of oxygen because person is at the lower altitude. Thus they are getting more oxygen, which will keep them more energetic, fresh and calm. So that may be the reason. So I am not saying this is the only reason behind that why they are fresh and energetic, but along with this fact we can say the sadhana, tapasya which is done by these yogis always play an important role in this. But if you consider scientific angle, more number of RBCs in blood will be factual answer for their energeticness or freshness. Okay, so this is the somewhat out of topic we are discussing. We are out of the track, we are coming to the track now. That is next factor which will affect the drug action, that is time of administration. Time of administration plays a very important role in drug action also. This plays a very important role in drugs acting on CNS mostly. For example, dose of barbiturate to produce sleep during daytime is higher than the dose to produce sleep during night time. So already in night time we are sleeping, and to induce sleep less dose is required if we are taking the dose at the night time. But if you want to induce sleep during daytime, the dose of barbiturate we have to increase it. So that is the importance of time of administration. Now another scenario, that is usually medicines are taken after meals. So why medicines are taken after meals? To reduce the gastric irritation. But food depresses the rate and extent of drug absorption, and in some specific circumstances drugs should be given on the empty stomach. So when drugs are given on empty stomach, first example is to prevent mixing with the food stuff. Many drugs are taken on empty stomach, that is before meals. For example, anthelmintics, which are used to kill the helminths or prevent the growth of helminths or worms in the intestine. So these drugs should be given on the empty stomach. Second example is to get immediate action of the drug. For example, drugs which are used against motion sickness. So motion sickness means if you are doing a journey in the bus, what happens? There is vomiting feeling is there. That is called as motion sickness. That is because of motion of the bus. Vomiting it is going to be induced. So in that case we want immediate action and drugs are taken on the empty stomach. And third example is that to prevent drug inactivation in gut, for example penicillin it combines with some food factors and it gets inactivated. So to prevent that inactivation, mostly the orally active penicillins, if we have to take, this should be taken on the empty stomach. So these are the examples which are related with the time of administration of the drug, that is before meals or after meals or at the daytime or the night time, the dose may be vary. Okay, next factor we have to discuss, that is psychological factor. Patient psychology plays a very important role in efficacy of drug or action of the drug. Patient should have faith in doctor or medical person who is prescribing him medication. If he have faith in doctor and medication, he will become better early. And if he is not having faith in doctor, time required to get cure can be increased. Hence many of us are preferring our family doctors, isn't it? Some patients have such a faith in doctor that if he touches or diagnose him, he will feel better. So faith is very important factor, and it is a psychological factor. Patient's attitude and expectations also plays an important role. If patient have attitude that I will be out of this situation as early as possible, it will help medicines to do its work easily and rapidly. But if the person is having attitude that I will not come out of this situation, I am not having hopes, then effect of drug cannot be seen properly. So we cannot get that much proper effect of the drug. So patient's attitude is also very important, and it is a psychological factor which plays a very important role in efficacy of the medication. This factor is particularly applicable to drugs acting on the CNS. For example, a nervous or anxious patient requires more general anesthetic to produce anesthesia than a normal person or normal patient. So a nervous patient requires more general anesthetic than a normal person. Now we are going to discuss a very interesting effect which is related to the psychological factor, and this is placebo effect. So what is placebo? Placebo is dosage form without drug but have similar physical appearance as that of dosage form containing drug, and often produces responses equivalent to the active drug. So it is the dosage form without drug but having similar physical appearance as that of the drug containing dosage form. Okay, so here you can see that a capsule A and capsule B both have same color, shape and size. That is, they are having same physical appearance. But out of these two capsules, capsule A contains the drug, but capsule B does not contains the drug. It contains powder of additives only and not the drugs, capsule B. But when capsule B is given to the patient, it produces similar effect which is previously achieved by capsule A in that person, that is with the drug. So capsule B is not having drug, capsule A is having drug. So if we are giving capsule B to the patient, we cannot achieve the effect, but we are achieving the effect similar to capsule A. How it is possible? So question arises, if capsule B does not contain drug, then how it produces effect? Here comes the psychology. Here patient is thinking that capsule A is given to him, I am getting relief from capsule A, and it becomes his belief that if I take this capsule, I feel better. Thus when capsule B is given to him, he administer it considering it as capsule A, and because of his belief and thinking that he is feeling better from this capsule, he is getting same effect from B capsule even though drug is not present in capsule B. And such type of effect is mostly seen in the psychologically ill patient. It works psychologically rather than pharmacologically. Placebo are used to treat a psychic patient who, according to doctor's opinion, actually does not require any active drug. So there is no need of drug in such patient, and doctor thinks that there is no requirement of drug in that patient. In such patient, placebos are given to the patient, and it will work also in that person. Next factor is pathological state. Severe diseases can influence pharmacokinetics as well as action of drug. We are going to discuss impact of two diseases on the action of drugs, which gastrointestinal diseases and liver diseases. So first we are discussing gastrointestinal diseases. These can alter absorption of orally administered drugs. For example, in colic disease, absorption of amoxicillin is going to be decreased, but in same colic disease absorption of cephalexin can be increased. So that effect or that change in the rate of absorption or extent of absorption can be seen if person is having gastrointestinal disease, that is the colic disease. Another example is liver disease. Liver is main site for metabolism of the drug. In liver diseases, rate of metabolism and hence the elimination of most of the drug is decreasing. Due to this, drug concentration in blood increases and toxicity of these drugs may be produced. We have to decrease the dose of drugs, and drugs should be given very cautiously in patients who are having liver diseases. Example, dose of morphine and barbiturate required to produce their effect should be severely reduced in liver cirrhotic patients. Okay, so that is about the pathological conditions. Next factor we are going to discuss is cumulation. Accumulation of drug in body after prolonged use is called as cumulation. So here what happens, drug gets accumulated in the body after its prolonged use. So it is called as cumulation. So question is, when drug gets accumulated in the body? Any drug will accumulate in the body if its rate of administration is more than the rate of elimination. Slowly eliminated drugs are mainly liable to cause cumulative effect. Many times because of accumulation of drug in body, toxicity may be produced. So as drug is accumulating in the body, its concentration in body it is going to be increased and it may leads to the toxicity. For example, prolonged use of chloroquine causes retinal damage. So it damages retina if this chloroquine is used for prolonged duration. Why it happens? It gets accumulated in body and its higher concentration may leads to retinal toxicity. Next is, full loading dose of digoxin should not be given if patient has received it within past week. So loading dose of digoxin should not be repeated in the next consecutive week. Why it is required? Digoxin is slowly eliminated drug and it gets accumulated in the body, and if loading dose is repeated before completion of the week, it may leads to its toxicity. Another example is, a course of emetine should not be repeated within 6 weeks. So that much accumulation of emetine can take place. 6 weeks emetine can remain in our body, that much slow elimination is there. Here also emetine is having cumulative tendency. As it is slowly eliminated, it is accumulating in the body. So course of emetine should not be repeated within 6 weeks. So that is about the cumulation. Now about the summary of today's video. In this video we had discussed various factors affecting drug action like body size, age, sex, genetics, route of administration, environmental factor, time of administration, psychological factor, pathological states and cumulation. 2 factors are still remaining, with presence of other drugs and drug tolerance. These factors we are going to discuss in next few videos. Till then, bye bye. Thank you for listening me patiently. If you like this presentation, please click on subscribe button and bell icon to get notifications of further videos. Like it and share it to your dear ones. If you have any queries, write me on my mail address which is given in the video. Thank you once again.